Good afternoon, everybody. My name is Skip Graham. I'm the VP of Sales of Marketing here at Mobilesmith. Today we're going to talk about deploying a mobile center of excellence at your hospital. So please feel free to submit your questions anytime along the way. You'll find a space to do that and go to meeting over to the side. And at the end of this, I'll try to answer them once we're done with the webinar. Our agenda today: why build a mobile center of excellence, how to assemble an agile, efficient mobile excellence team at your hospital, best practices of hospital mobile ROI opportunity discovery and app ideation, and 3 examples of high-impact hospital apps and their stories. So, why build a mobile center of excellence? So remember how hospital mobile apps started out several years ago. Typically it went kind of like this. CEO would say, every other hospital is launching a mobile app, we need a mobile app too. But who should do it? How should we do it? How should it be built? People would start throwing out ideas, and in a few months you'd hire an IT developer or somebody in the IT department would come up with an app, and then surprise, surprise, you've got something that kind of matches what everybody else has, and nobody downloads it. One of the considerations that's often lost when you think about a mobile app for a hospital is that there's got to be some sort of a marketing plan that goes around it. You have to find a way for people to actually come in and download this thing and have a need to do it. Those considerations often add a lot of cost, and we'll go over some additional ideas on that as we move forward. Meanwhile, over time, the mobile health landscape has progressed tremendously. There are now more than 259,000 healthcare apps in the Apple and Android stores today, according to a recent research to guidance report, but the clinical evidence to support the ROI is still lacking. Why are people building these apps if they're not getting a return on their investment? What's most important is the hospitals are seeing less than 2% of their patients adopt their branded apps, according to an Accenture study. Not to mention, health apps fail to be accessible or useful to those people who presumably need them most, the sickest, most vulnerable, most underserved populations. So why is it that hospital apps fail? Well, for one thing, hospitals tried to build a one app to rule them all philosophy. And I understand this. If you think about what happens in a hospital, you want to control the branded experience, you want to control the user experience. So the thought is, if we have one gateway into this process, then what we have is the means by which to make sure everyone has a patient experience that is the best possible. But if you think about sort of the analogy that's up here of the Swiss Army knife, it has a ton of functions, but none of the functions are everything that you need it to be. The scissors are too small, the tweezers don't work so well, the bottle opener barely gets the wine open when you really want the wine open. So when you take these considerations into place, the issue is that if you're going to have an app that's going to serve a purpose for a particular audience at a particular time, it needs to meet those exact needs. And that's one of the things that we have to kind of always come back to. So where do you go from here? How to succeed in mobile health apps? McKinsey did a really big study in 2014 and came back with 3 recommendations that are very simple. Think big, start small, act fast. Those are pretty words. And you sit there and go, that's nice to say, but what does that actually come out to in practice? Well, we've distilled a practical approach that follows these recommendations. And the core of that approach is go for quick wins. I can't stress this enough. When you sit down and you decide, maybe we should build a mobile app for our hospital, and you start thinking of this huge, giant hospital app that can do all kinds of things, the amount of work and effort that's going to have to go into that before you can show any level of success is tremendous. And if you're wrong about your approach or your budgets or the things that you're going to do as an outcome, then what you end up with is a huge failure, and everyone takes a step back from mobile, which is one of those powerful tools coming into the hospital space. When instead, you could simply pick a very simple problem that you want to solve with a very simple app, what we call a pinprick app, and then launch quick prototypes to test with focus groups to ensure that you can actually make this app successful. It's the standard classic agile approach methods that hospitals are beginning to adopt, that businesses and coders have had for a long time. So let's talk a little bit more about this. The real challenge comes when you try to identify the app ideas that will generate substantial ROI for your hospital. This is where the mobile center of excellence comes into play. Mobile ideas can flow from any direction, from any department, any organization. Some of them will be more practical, some of them less. So how do you identify the good ones? Discard the not so good ones and transform these ideas from idea to efficient mobile app. You need a mobile center of excellence, that's number one, and then the methodology, number two, and then number three, the team that can put it into practice. So let's start with the methodology. Pitfall in most mobile teams is that app ideas are too feature-centric. When thinking about a mobile app, people will say, let's include this, let's include that, let's put something in here where we can track medication, or something that will look at body mass, or all of these different factors. What you end up with is a long laundry list of features that are nice to have, but not absolutely necessary. End users will open up the app, play with some of the features, and then ultimately forget it or delete it. The mobile app investment is usually lost, flushed down the drain, because what you didn't do was look at the primary problem. Pitfall, most apps are feature-centric. Antidote, love the problem, not the solution. So the first thing that has to happen with your mobile center of excellence is you have to build a process by which you can do problem discovery interviews. This is the best way to conduct one. As well as your end users, patients, and colleagues, what you need to do is learn about their pain points. You will discover different mobile moments that you can leverage to improve and facilitate their work. Here are the questions you can ask. So look at this. How would you describe your role? What does success look like for you? So are we talking to a clinician? Are we talking to a patient advocate? Who is it that we're exactly speaking to? And in the end, when you're talking to them about what the outcome would be, have them really break down into the KPIs, the key performance indicators of what that outcome success looks like. We have more people complete the program. We have fewer people actually readmitted to the hospital. We have more compliance with the medication. Whatever that outcome is, you need to quantify it and then have it somehow marked down as a number that you can look back on to determine success. What's the hardest part about achieving that success? Now, here's kind of the thing. When you come in and you say, well, one of the things that we have is we have a particular patient who's coming along, and the primary issue isn't that they don't want to do what we tell them to, it's that they forget, or they lose the information, or they have some way in which they don't understand exactly what they were told. Right there, what you've gotten to is the essence of what the problem is. Then you come forward and say, can you tell me about the last time that happened? And when they dig into the specifics, you may find what the solution is just within what they're already trying to do. In most cases, when a hospital department has a problem, they already have a solution. They've already figured out what they need to do. The problem is, how do you execute on that solution in a way that's meaningful? If you hand them a printed piece of material that says, okay, we figured out what the problem is, all you have to do is follow this list of stuff, and that will fix the problem, and the patient goes home and loses it, the problem wasn't that they didn't follow the list of stuff. The problem was that they lost the paperwork that it was on, or that they forgot. And so we come back to the fact that you've already got what the solution is. It's listed right here on this piece of paper. How do we turn that into a mobile app that they can't lose because it's now with them all the time? And how do we make sure they don't forget because it activates and reminds them what to do? Again, there's no rocket science here where we had to come out and say, oh, we have no idea how to solve the problem. They already know how to solve the problem. Why was that hard? What is the difficulty that's going on right now? Because it can change the way the app is actually set up. Are we talking about something that deals with dementia? Are we talking about something that deals with economic status? Are we talking about something that deals with confusion? Those things will also help determine what you're going to do with the app. What, if anything, have you done to solve the problem already? And those are the things that ultimately become the solutions yet again. And what don't you love about the solutions you've already tried? In most cases, what they're going to not love about the solutions they've already tried is that it's the right solution, but there just doesn't seem to be a way to maintain the connection with the patient so that you can force there to be some sort of continuation of that solution. The worst problem that most hospitals have, and this is why the concept of connected apps and mobile apps are so important, is where the whole process falls apart is the patient walks out the door. That's going to happen. How can I find a way to keep myself connected to the process? How can I find a way to keep myself working with that patient when I'm not even there? A mobile app is the primary solution to that. So, step 2, you've got to build your mobile experience team. You've identified the problem, Now it's time to build the team. What kind of people are you going to need on a mobile experience team? One, you need business stakeholders to contribute to goal setting. Even though the most cost-efficient apps are a waste of your time and money if they don't improve the organization's KPI, it's best if you go ahead and figure out that somehow, whatever this KPI is, you've defined that success so that you can attack it over and over again. So if it's patient acquisition, if it's patient satisfaction, if it's physician engagement, any of these things, you have to define those metrics. Two, you need creative input from those stakeholders. People who are closest to the patients are the best people to come up with customer-facing app functions. Chances are there are more than one people on your team who will generate most of the best mobile app ideas. Include them in your mobile center of excellence and make sure they are involved in test driving the prototypes. And this is one of those things where, as you begin to move forward with this, you'll begin to recognize who is the type of thinker that thinks in a way of their problem solving that it begins to match up with the capabilities of what mobile happens to contribute. And once you find those people, you make them part of the permanent team so you can continue to rely on them regardless of what department they might be from. Number three, if you're serious about mobile apps making a business impact, you have to think about data. This requires, in most cases, setting up connections to back-end systems, maybe your patient portal, wait time tracking systems, anything like that. But just like you're going to need creative people on your mobile center of excellence team. You need data people who understand how mobile data should be structured, manipulated, and laid out. You're going to have to involve the IT department early on and make sure they fully invest in the success of what your mobile strategy is actually going to be. The third and very important component of a mobile center of excellence is the implementation of an Agile methodology. Now, you hear the term all the time, and your instinct right out of the gate is that, yeah, no, I get it. We move fast, we can go left, we can go right, we can be agile. In reality, Agile methodology is a very specific thing. It has a process. Many IT departments now use it for their applications and development projects, and forward-thinking hospitals are adopting Agile for mobile app development as well. When I go to the trade shows, when I walk into a session, when I do anything like that, the most progressive hospitals, the Jeffersons and these kind of things, the Einsteins, they come walking out the door and they're all talking about the concept of an agile development process, not just for their apps, not just for their IT departments, but for their business processes across the spectrum. And so what you have to do is be ready to adopt the exact same kind of concept. And agile methodology is characterized by short sprints with iterative development and much faster app prototyping so you can gather feedback at an early stage. So, your initial discovery and ideation is usually followed by building a very quick prototype. That means you get it quickly tested with a focus group. Then the feedback is used in the next iteration, and every sprint takes less than 2 weeks, and sometimes as little as 1 day. That way, by the time you launch the final product, you're confident that it meets the expectations and requirements of your target audience. Now, here's the problem with an agile methodology for mobile. It's not easy to get a team of mobile developers to be able to quickly turn around what it is you're talking about. Not only that, it's not very cost effective. An iOS developer and an Android developer, because you would need both, because you need both types of platforms having been coded to, would then have to build each new idea from scratch, would then have to edit the original code, would then have to test through those particular processes. Highly expensive, highly time consuming. And that's been one of the problems. When you go out and you talk to people about what their hospital mobile plan is, they have a bunch of developers that they know they can contract to. They look at the cost associated with that, and you go, great, you need to build a whole bunch of little apps. It's not cost effective, it's not time effective, and it can't follow the Agile methodology. Now, the Mobilesmith Platform, on the other hand, that changes the entire concept. So Mobilesmith's been working with multiple U.S. hospitals, helping them generate ROI-focused apps and deliver efficient apps. So when we come forward with you, we basically follow this process. Discovery and planning, so we talk about our app blueprints, which are these proven templates to ensure rapid deployment of long-term ROI-based apps. We have 12 app blueprints right now that will cover everything from post-op to pre-op to emergency room misuse, infection control. There's a variety of different things that we've got already preset in the system that you'll be able to come into and actually use in order to get your apps up and moving quickly. As far as design and prototyping, you can quickly modify the blueprints with your own graphics and then send a test app to all of your stakeholders. That's the other great thing is once you actually work within our platform and you have an app where you want it to be, you don't have to have any coding skills to do that. You can simply hit the button, a build will be sent to you. You can send a link to that to all of your stakeholders. They can download it to their phone, use it, test it, send you back their feedback. You can make the changes. All these things can happen almost instantly. On the development side, we have wizards and guides that will connect you with the data so that our stuff can connect to your data and different plugins that you've got on your end once your IT department becomes involved. When we actually hit the build, we have this patented no-code build system that basically provides you full native apps, the same as if you had an iOS developer or if you had an Android developer, and you can begin your testing with just one click once you have these out, and then you're able to submit them into the store so that they're available in the App Store, or you can actually keep them as enterprise apps where you simply have the link to it and you supply that if you want it to be something that's not in the store but just used locally. And then on a maintenance basis, since you have a dashboard that has all your apps listed in it and you can open them and edit them at any time, you have the ability to add new features, to test prototypes, to make modifications, to edit content. When you're doing all of those things, you finally have a process that makes the concept of a mobile center of excellence, where all these ideas begin to come and flow into, be produced into something that you can actually work with because the platform allows you to have control over all of those things. So we wanted to give you a couple of examples of hospital apps that were built using a mobile center of excellence methodology. So let's start here with the customer app from Summit Health. Now this is an app developed by Summit Health, and they're located in Pennsylvania, and they're one of the nation's top 20% of best performing health systems. The initial idea was to build a general hospital app, and the project was led by the Chief Information Officer. While the team was determining which of the providers should be included, the app building team began working on additional functionality based on the feedback they received. They were able to send out prototypes, say, what do you think, send it to different providers, ask them their opinion on things, get things back, and apply that feedback instantly into the platform and spawn out new versions of the app. Once the app was launched, they've been able to update the app fairly quickly with new functionality, and they've worked on a way to actually continue to get feedback through the app through some forms they have, and they continue to change it on an ongoing basis. So their problem was drive patient volume for primary care locations. Their solution was find a primary care location nearby. So one of the things that's key here is when you have a true mobile app, that means it can use all of the functionality within the phone itself. So since the device happens to have all the mapping capabilities and the location capabilities, all those things come into play. It knows exactly where you're at. It can show you where you need to go, give you directions, do those types of things. Then they have the ability to search for primary care physicians based on specialty and other things like that. Next, this is a great example of a problem-centric hospital app that was built using the Agile methodology of problem discovery. So the problem is, how do I drive referrals to the Maryland Medical Center? So their solution was immediate mobile access, so that you can get right in there and see where the referral should be going. Urgent and non-urgent referrals. Then you've got the concepts of cardiac surgery, aortic disease, all these different conditions that you can look things up specifically so that the referrals could happen in that way. Initially, the University Medical Center had built 4 separate apps using a custom developer. And they used medical students who knew coding, and after a while, the app's not been updated. They started to look stale and old, plus there's issue every time the phones would actually update to a new version of iOS or Android. The apps were no longer compliant. Our system manages all those things. Nobody has to go in and change anything to keep the apps compliant. We make sure that those things happen automatically. So then they came to us, and the goal, of course, was to create a more agile way of developing and managing the apps, drive more referrals, more efficiency. They decided to combine all 4 apps into one. They built an initial version and had it update with additional specialties several times since then. I mean, that's the other great thing about this is the idea is the apps are alive. You can build it, you can send it out, and as you get new ideas or as you want to add things to it, you can go right back into the platform, make those changes, and as soon as you hit update, the updates will go out across all of the app. As new departments have learned of this app, they've all wanted in. They've worked with the team to get their information included, so it's been a constantly growing thing. And now the combined app with all these pieces looks great. It's earned several awards, and user adoption has been quite impressive. Next, the Sarasota Memorial Healthcare SMH Baby app. Now this is a very popular use case, pregnancy apps. The marketing person here was a real whiz with our platform. See, that's kind of the point. You don't have to be able to code. If you have the skill level to do something like Photoshop, you can be trained into our platform and be able to build full apps just like this one here, which was built by somebody in the marketing department that has no coding skills whatsoever. But he came in and he customized one of our blueprints for Sarasota. He showed the app to the OBGYN department. They loved it and moved quickly with new content. And this is something that literally the marketing department and the OBGYN department did entirely themselves, with no involvement from any of our designers or any project managers, nobody from the IT team. This is their whole app, and this is the second one they had actually put together on our platform. Coming back to that same idea of the fact that you have an app that can grow, originally this app had all the things that you would need on a prenatal basis, where it tracked, all the aspects of your going through the first and second and third trimester. But then afterwards, they wanted the app to remain relevant after the baby was born. And so they went in and started adding new features. They added a breastfeeding monitor. They added all these different types of things to try to take it through the first year of the baby's life cycle so that they can continue this relationship. Now, here's something that's kind of, to me, really exemplifies why you need multiple small apps as opposed to one giant app to rule them all. Everyone talks about the idea of patient experience. Everyone talks about wanting people to be able to have a tool that works effectively. Everyone wants that experience to be somehow unified. Well, if you want to talk about what is the patient portal for somebody who's going to use a mobile app, they already have a patient portal and they already have a user experience. It's called their phone. When they pick up their phone, they expect to go right to what they need. They don't expect to come to one app, click on a menu, click on something else, click on something else, click on something else. A great example of that is a large hospital app that gives you directions on how to get there, where your physician is, and when we say we'd like to give them a tool in which to monitor and manage their diabetes, the clinicians say, well, we want it to be in the same app. So now they have to go find the hospital app. They have to go to the menu. They have to go to the My App section. They have to go to a drop-down. They have to go to diabetes. They have to go to diabetes management. If you think they're going to do that every single time they have to record their blood sugar level, that's not going to happen. What they want to do is they want to open up their phone, hit the My Diabetes app, and have it pop up and say, what is your blood sugar level? Because that's the point of the app, or whatever else you need it to be. This is a great example even on the marketing side. If you're going to have an app that is going to help people with leukemia and try to get them through the process of having just found out they have leukemia and what are the things they're going to need to do and then how to manage that, that app on a branding basis, even if it's from the same hospital, is going to have a different user experience than a baby app like this one. And the reason for that is this is a joyous moment. It has to have a feel of that. It has to bring out the whole idea that we're here to share and uplift in this. That's not going to be the same thematic or the same concept or even the same usability as something that goes to a different aspect of what the healthcare system may be dealing with or the patient. And you want to be able to deliver on that to each of those people. That's why when you go into a hospital and you walk into the children's ward, it has a different feel than if you walk into the emergency room. These things have certain usability and functionality, and you want to be able to tailor to those kinds of things. So Mobilesmith can expedite the deployment of your mobile center of excellence. Now, number one thing that you can do if you have our platform is obviously you get certified on how to actually build the apps. But then in addition to that, we have a process by which we come out, meet with the marketing departments, the IT departments, and spend a couple of days with them working through how they can actually build their internal mobile center of excellence, what people they can actually use, who should be on that particular board, how are they going to take the apps that are actually brought in. One of the things that often comes up is when a marketing department discovers that they have an app that is really successful, their concern is, what if every department suddenly jumps forward and says, I want an app? Well, that's a great problem to have if you have a mobile center of excellence in place, because now that you have a process by which they submit their needs, you have a way in which you can tell them the limitations of what your staffing and your abilities are. You can set out a criteria. We're going to be launching one app every 6 weeks. You have to be in the queue. And then you also have a means by determining which apps are the most likely to succeed, which ones are the most important, and how you'll be able to report on them afterwards that they have succeeded. With all of that, you're pretty much guaranteed success. You're also able to approach the different lines of business and communicate with them to what they have to do in order to come to you with their requirements. And you'll be able to internally as a team also be able to ensure that the apps you put out meet the requirements of being true ROI-based apps, meaning they solve a problem with a solution that you can measure and report back on. That is one of the highest criteria that you're going to need for people to look at your program and say, this was successful. Now, does anyone have any questions? we'll wait here to give a little bit of time if anyone would like to type in any questions, and once we have those come in, we'll actually and thank you for the thank yous for the good presentation. I always like to be patted on the head, just like anyone. All right. Doesn't look like we've got anything coming in. You can see that my name is Skip Graham. I'm the VP of Marketing and Sales. If anyone would like to contact me directly, you can do so at skip.graham@mobilesmith.com with any additional questions you might have. Again, that's skip.graham@mobilesmith.com. And hopefully I'll be hearing from some of you and be able to give you help. Thank you very much for attending this. Remember, we have lots of webinars that we put out. So please come to our site and register for our newsletter where more things will be updated there, and you'll also find lots of resources about the different types of apps we've got, the blueprints that we've got in our store, and the resources that you can also pull in to use other aspects of industry discovery. Thank you very much, and look forward to hearing from some of you soon.